Hi, I'm Dr. David here at Magnolia Skin Center. This little video is one of my favorite topics. We're going to talk about Agnes RF treatments. The RF stands for radiofrequency, okay, which is the energy involved. We're going to talk about Agnes RF microneedling. Okay, so some questions have been prepared by staff that you guys have asked, so let's get right into it. Will this treatment actually clear up my active breakouts and smooth out old wrinkles at the same time? The answer to that is yes. Let me back up a little bit and explain this because there's people hear microneedling, they hear radio frequency, they don't really know what this is involving. A lot of microneedling radio frequency treatments have to do with like a stamping where we stamp the face and 25 needles go in, and when they're in, they deliver radio frequency. This is different. Agnes radio frequency microneedling is more of a sculpting tool, okay? And it's artistic and it's very specific. So the needles, and they're different, they're needles that have one needle or three needles, but the needles are the hub of them is insulated so that when I go in with that needle, the energy cannot be delivered to the skin, and instead I deliver the energy under the skin. Which of course you're all numbed and everything first, so there's no pain involved. But why are we doing this? Because I can deliver the energy under the skin high enough to, number one, shrink wrap the skin. So I literally can make the skin go, okay? So I can tighten, I can get rid of extra saggy skin, okay? I also can lift or sort of tack the skin and attach it to a higher area. So if I want to raise your brow or raise your neck or your jawline or your jawline or whatever, I can do that. And the third thing is that energy delivered under the skin turns on a regenerative response with your fibroblasts so that for the next 4 months after I've done it, you regrow your collagen, elastin, and your fibrin, and you get your young, healthy skin back. Okay? So will it actually clear any active breakouts and smooth out wrinkles at the same time? Yes. Why is it going to smooth out wrinkles? Because it regrows your connective tissue under the skin. The reason why you have wrinkles is because the connective tissue has gone away, so the skin has caved in, right? If I regrow that, it pushes the wrinkle back out. Okay. And question number two: how is this different from a regular microneedling facial I could get anywhere else? Okay, there's two types of sort of low level microneedling facials. If you're talking about a microneedling like an esthetician can do, okay, that's just kind of a roller thing that goes on your face that makes holes. Okay, so the idea is you're creating channels or holes that start to cause a healing response. This is way more than that, and that doesn't involve any energy base with it. There's also the types I was talking about earlier where we can stamp with 25 needles, and we do have that type here also, and deliver the energy underneath. That will do a lot of the same things I'm talking about, but it's not quite so sculpting and specific. So it's I can literally sculpt and change your face. I can tighten, I can lift, I can get rid of wrinkles, all of that with this technology. Does it hurt more than a standard facial? And what do you do to make it comfortable? Yes. If I did not do what it takes to get you really numb, it would hurt, but because I do take what it takes to get you really numb, either by topical numbing, by injectable numbing after topical numbing, or even nerve blocks, then I'm going to give you an experience that is completely painless. Okay? Unlike a surgical facelift, will I have scars or major healing marks on my skin from the needles? No, you will have no marks or scars whatsoever. When you do a plastic surgery, like for instance, the deep plane facelift, they have to make cuts, they have to lift the skin, they have to undermine it, pull it, cut it off, and sew it back up together. Okay. If I'm lifting this with your neck by tacking and lifting and shrink wrapping as I go, that by the time I get up to here, there's no extra skin. So I don't have to cut anything out. So there's no scar at all. Okay. Um, how do the needles go to fix the damage? And is it safe for darker skin tones? Okay. So the needles are under the skin and they're delivering the energy under the skin. So that energy delivery under the skin turns on the cells in your body that are called fibroblasts that regrow your collagen, elastin, and fibrin, and regrow your blood vessels so that you get young, healthy, thick, um, moist, dewy, glowy skin again. Okay. And oh, darker skin tones. So, because we are under the skin and I'm determining where I'm delivering that energy, I'm staying away from the areas where the pigment cells are so that I make sure I do not damage those pigment cells. So, this is completely safe in darker skin tone. All right. Um, how long do the skin smoothing results last before I need to come back in? Okay, think of it this way. I am regrowing your young healthy skin. So basically, if you have 70-year-old skin, right? And I do this so that I bring your skin back to 50-year-old skin, and then basically you just start aging from 50 again. So it depends on the rate at which you age, which if you are taking care of yourself, eating healthy, living healthy, um, protecting your skin from sun, and doing good skincare, it's going to age slowly from that time. So it's going to be very long lasting. Will this solve my uneven skin texture problems in just one session, or does it take a few tries? So you will get dramatic improvement in one session, of course. It depends on how much work we need to do, right? If you are have a lot of significant issues, this has to do with your age. If you're coming in and you're much older and you have a lot of issues, it's going to take more treatments maybe for you to get exactly where you want to be. If you come in at a younger age, it's going to take less treatments. So it just depends on where you're starting from, but you are going to get uh, dramatic improvement in your skin texture even with the first treatment. So I hope this helps you understand a little bit about this amazing tool. When you come in and sit down with me, I will educate you a lot more. I will help you see whatever you need to learn about it so you understand it. So thanks. I'm Dr. David at Magnolia Skin Center.